Hello, and thanks for joining us. Welcome to the 2020 American Diabetes Association Living with Diabetes Ask the Expert series. Today's topic is diabetes by the numbers. That means we are discussing all the recommended target numbers for glucose, blood pressure, and lipids to help you keep healthy. My name is Carla Cox, registered dietitian nutritionist and certified diabetes care and education specialist. For those of you on the phone, press *3, that's *3, on your keypad, and an operator will collect your question and place you in a queue so that you may have the opportunity to ask your questions live. To participate online, type in your name and question in the fields below the streaming player. Press the Submit Question button, and your question will come directly to us. Stay with us through the hour, and we will send you useful resources to help you live well on your journey with diabetes. In addition, we invite you to provide us with your feedback in our 5-question survey at the end of the event. Okay, now a little bit about why we are here today. Because of the link between diabetes and heart health, the American Diabetes Association, in collaboration with the American Heart Association, has launched No Diabetes by Heart with support from founding sponsors, the Boehringer Ingelheim and Eli Lilly and Company Diabetes Alliance, and Novo Nordisk, as well as national sponsors Sanofi, AstraZeneca, and Bayer. The No Diabetes by Heart initiative provides tools and resources for people living with type 2 diabetes to learn how to reduce their risk of cardiovascular disease. As part of the initiative, the ADA is holding this free educational Q&A once a month. We'll cover information and tips to help you take charge of your health. The health and safety of all those we serve at the American Diabetes Association is always our top priority. The CDC has determined that COVID-19 is a serious public health threat. In general, people with diabetes face greater risks of complications when dealing with viral infections, and that is also true for COVID-19. Current CDC recommendations to protect yourself state that you wash your hands often. If soap and water are not readily available, use hand sanitizer that contains at least 60% alcohol. Avoid touching your face. Practice safe social distancing and put distance between yourself and other people. Cover your mouth and nose with a mask or cloth face cover when around others. The ADA encourages people with diabetes to follow the guidance of the CDC and to contact your medical provider if you suspect that you are showing symptoms or have been exposed to COVID-19. For our most up-to-date information, please visit our website at diabetes.org/coronavirus or call 1-800-DIABETES or 1-800-342-2383. Like many of you, we are also practicing social distancing, and so we are proud to present this month's Q&A from our own living rooms. I am now happy to introduce Dr. Joshua Joseph. Dr. Joseph is an assistant professor of medicine in the Division of Endocrinology, Diabetes, and Metabolism at the Ohio State University Wexner Medical Center. He graduated from Boston University School of Medicine and has previously been on faculty at Yale University School of Medicine and a fellow in diabetes research at the Johns Hopkins University School of Medicine. His patient care focuses on a team-based, patient-centered approach to living with type 2 diabetes, focusing on lifestyle behaviors and medical therapeutics. An impressive resume, and we are delighted to have Dr. Joseph here with us today.
Well, thank you so much, Carla. I really appreciate that.
Do you want to add a few lines of introduction for yourself?
Oh, yeah, that would be great. So good morning, everybody, or good afternoon, depending on whether you're on the West Coast or the East Coast. Happy to be here with everyone today. As she mentioned, I am a diabetes physician and scientist, really focused on how we can better improve prevention and treatment of diabetes and heart disease. As many individuals know, and as discussed earlier, heart disease is the #1 cause of death in diabetes. And so I think this No Diabetes Diabetes by Heart initiative is just so key, and the Living with Diabetes series for those patients with type 2 diabetes is just an excellent platform to be able to engage around diabetes health.
Thank you. As we are waiting for our callers and online listeners to chime in, I'm going to go ahead and kick off with the first question. The new term used to discuss glucose values is time and range. Could you explain what that means?
Yeah, so that's a great question, Carla. And when we think about time and range, we'll take one step back and discuss how we actually check our blood sugars. For many years, many of us used a glucometer. We checked our finger, right? And then on that glucometer, it gave us a number. We did that, for some folks 1 time a day, up to maybe 4, 5, 6, 7 times a day. And we used that technology for many years. But over the last, 15 to 20 years, we really advanced in how we treat diabetes. And one of those advancements have been continuous glucose monitors. These devices go on the arm or on the abdomen, and they are able to pick up what the blood sugars are kind of minute by minute. And so, they can, over the course of the day, really get 24 hours of data if worn. And they've progressed over time to where they need to be changed less often, some out to every 2 weeks, others even out to every 3 months, and have really advanced diabetes care. And so one of the things that you get when you have these continuous glucose monitors is that ability to see where those blood sugars are throughout the day. And so when we think about the time and range metric, it is measuring how often the blood sugars were between 70 and 180 throughout the course of the day. And what we know about that is that when the time and range approaches 70% or more, then individuals often have an A1C of less than 7%. When the time and range is about 50%, the A1C is around 8%. So we really want to shoot for having greater than 70% of the day in range, that range from 70 to 180.
Thank you very much. If you're just joining us, welcome to today's Ask the Expert Q&A, Diabetes by the Numbers. As a reminder, for those of you that are on the phone, press *3, that's *3, on your keypad, and an operator will collect your question and place you in the queue so that you may have the opportunity to ask your question live. To participate online, type in your name and question in the fields below the streaming player. Press the Submit Question button, and your question will come directly to us. Now let's take the first question. George, can you hear me?
Yes.
George, you're on. What is your question?
My question is, I'm 80 years old, and my A1C had been running in the 70 range, and my question is, it's jumped up about 10 points over the last 2 doctor visits, and I'm wondering, for my age, is that normal, or what should I be targeting?
Yes, George. So thank you for that question. And you said that your A1C was in the 7% range?
7, yes, and now it's 8%.
And now it's 8%, and you are 80 years old. Great. So that is a fantastic question, George. And so when we look at the data here, one of the considerations that we think about when we think about that A1C target really is age, as well as what are the other, what we call comorbidities, things like, kidney disease or heart disease, when we're coming up with that target of, 8% versus less than 7%. And, in your case, given that you're 80 years old, and especially if you have any other coexisting issues, including, low blood sugars or kidney disease or heart disease, a target of less than 8% may be very appropriate. And so that is where I would definitely talk to your doctor to talk about the risk and benefits there. But for many of the individuals I treat that are in their 80s, I do use a target of less than 8% for them. But like I said, that would be a very good conversation to have with your provider.
Thank you. Norma from the Bronx, could you let us know what your question is, please?
Yes, hi. Thank you, doctor. Well, I have diabetes for 25 years, and I've always had it pretty well controlled, under 7. Now I'm 86 years old, and it reached up to 7.2, I think. And I did get heart disease, and I was pretty disappointed because I thought I had it so well controlled, and I got a congestive heart failure anyhow. And is that normal, or what do you think, doctor?
So first off, Norma, congratulations, 86 years old. That's wonderful, and many years of great diabetes management. So you are to be commended, and that is just fantastic work. And so, the question around, the development of cardiovascular disease, and in your case, what you were talking about there with congestive heart failure, is that there are a number of different conditions that can lead to congestive heart failure, including things like most commonly high blood pressure. It seems like from a diabetes standpoint that you did excellent, and that it sounds like you're continuing to do excellent. As noted with the previous caller, George, an A1C at age 86 of less than 8% likely would be the recommended target, particularly because you have the congestive heart failure. And the reason why that is, I probably should explain that a little bit. The reason why that is that we don't want you to have low blood sugars. What we've done in medicine and in science is we've run a number of trials and research trials over time that have shown that when we try to shoot for a lower A1C target, whether that be less than 6.5% or less than 6%, particularly among those who have a few more years, right, that what we see is that we get more low blood sugars, and this actually leads to more complications. So we actually don't shoot, our target is a little higher because we want to avoid those low blood sugars. And so I would say at 7.2% that you are doing very well, particularly if you are not having low blood sugars at 7.2%.
Thank you very much. We'll go to our next question. Gloria, can you share with us your question, please?
Yes. Good afternoon. My question is, I'm 65, and I take Tresiba 12 milligrams every night and Olympic once a week. And today I took my blood sugar this morning for a meal. It was 141. Usually it's like lower, but for some reason I'm not feeling well today. Okay, 2 hours later it was 217, and I just wanted to know, are those good numbers, and how do I determine what is a good number, like 2 hours after you eat?
Yeah, those are great questions, Gloria, so thank you for asking those. And so the recommendation in the morning when you wake up is to have a fasting sugar before you eat of 80 to 130. So the 141 was just mildly above that, and it sounds like you're normally lower than that in the morning. Is that correct, Gloria? And so, the recommendation, like I say, there will be 80 to 130 in the morning. And then when we look throughout the rest of the day, our goal is to have a blood sugar less than 180. So the 217 was kind of mildly above that. And so I would say that, on, just using today's blood sugars, your blood sugars were just a little bit mildly elevated. But what we know is with this pandemic going on, our research group and others has been publishing a lot about the role of stress in diabetes. And so even day to day, you can have some fluctuations, particularly around the stressful events that are ongoing currently. And so if normally you're kind of in that 80 to 130 in the morning, and then you're less than 180 2 hours after meals, those would be at target. So it sounds like normally you're doing pretty well, and today there may be something just a little bit different. But we all have days that are a little bit different. So it sounds like overall you're doing a really good job.
Thank you. Clarence, are you on the line?
Yes, I am. Thank you for taking my call. I'm calling. What I wanted to know, I am 72 years old. I am still, unfortunately, morbidly obese, but I have lost over 100 pounds. I have the type 2 diabetes. I also am in congestive heart failure. They have reduced, since I've been on the program, my intake of metformin from 2,000 milligrams twice a day to 1,000 milligrams twice a day. And my hope is that maybe someday I can completely come off of the medication if I continue to lose weight and eat sensibly and what have you.
Now, Clarence, can you tell me a little bit about the program that you're on?
Well, I say program. The program is that I have started paying attention to what and how I eat. I wasn't given a specific diet. They were telling me to actually my doctor told me to ease up because I was really, at one time I weighed 367 pounds and now I weigh 254.
Gotcha. So first off,
go ahead. I'm sorry.
Oh no, go ahead, Clarence. I apologize about that.
No, I was through. I was waiting to hear what you had to say.
Yeah, so I think that you have taken a major step in improving diabetes. So weight loss, when we look at it both with diabetes prevention and with diabetes treatment, in many ways is the most significant step that any of us can take. And the question I often get is, well, why is that? And so when we think about diabetes and we think about what diabetes is, when I'm in the clinic, I often use the example that, if we think about our blood vessels as pipes, right? And we have sugar in there, and we know we all need sugar. Sugar creates energy for the body, right, so that we can do all the things that we want to do. And so, but the key with diabetes is that sugar can't get out of that pipe. And so we have insulin that kind of, takes the hand of that sugar and opens a door so that sugar can then leave out the pipe into the muscles and kidneys and liver and brain and everywhere where we need sugar in the body. And so what diabetes is the inability to open that door, specifically type 2 diabetes, either due to a lack of insulin or that door is just really sticky and hard to open. And the medication that you're on, metformin, is one of the medications that is kind of like WD-40 for that door. It helps to open that door so that sugar can leave the blood vessel and go all the places that it needs to go. But weight loss also does that. It decreases what we call insulin resistance, or the ability to open that door so sugar can get out. And so with your 100-pound weight loss, many individuals are able to come off their medications. The two things that we look for here when we're trying to do that is that the A1C is less than 6.5%. And that it's been sustained, the weight loss is sustained over time. And it sounds like your medical team is kind of lowering the dose of your metformin, already down to 1,000, and I imagine will come down to 500. If things stay stable, I imagine they will bring you off. And last but not least, I like to say about that is that there are some medications that we have now that not only treat diabetes, but also help to treat heart failure. And Clarence, as you know, we try to use the most confusing names possible when we talk about these, but they go by the name of SGLT2 inhibitors. and they actually help with the management of not only diabetes, but also heart failure. And so we even sometimes use these in patients that don't have diabetes. So you may want to talk to your doctors about that class of medications, once again called SGLT2 inhibitors, because long term they have been shown to reduce the risk of many things, including cardiovascular death. So I would definitely talk to your treatment team about that and see if that might be an option for you as well. But once again, I want to congratulate you on that weight loss, because that is one of the best ways to improve diabetes care and improve the diabetes numbers.
And it's hard to do. It's hard to lose weight and keep it off. So that's great.
And it's hard to lose weight. And 100-pound weight loss is, that is just tremendous. So Clarence is definitely to be congratulated.
Absolutely. For those of you participating online, resources will be noted at the end of the event. Live links to our resources are also located at the bottom of the registration page, diabetes.org/experts. Okay, let's take another call. This is an important one coming from Vicki. And
hello.
Vicki, can you hear me? Hi, Vicki. Can you give us your question, please?
Sure. I'm 69, which is kind of irrelevant for this, but I'm in a controlled type 2 diabetic. My last A1C, in fact, was this morning, was 6.3, which was a little up for me. I'm normally like 5'9", but that's kind of my fault. I'll take blame for that. But my question is, since I am a type 2 and I'm a controlled type 2, is the constant glucose monitoring systems important for us to use as well?
So that's a great question. Can I ask you one follow-up question to that, Vicki? Do you take insulin therapy?
No, I have not needed insulin. I'm on the metformin 500 twice a day now. It was once a day until a couple of years ago. I started to climb up a little bit, and my doctor put me on twice a day.
Okay. So you're on metformin. And so thank you for that question, Vicki, and that's a really important question. So I'm going to answer that question in two ways. So the first way is that, when we think about starting someone on a continuous glucose monitor, one of the pieces that we think about is insurance coverage. We want to make sure that these monitors are affordable and that they fit within everyone's budget. And so we, have to look at the insurance to figure out, what are the requirements for specific insurance providers. And so some, will cover without individuals being on insulin, and some won't, depending on how many times they check their blood sugar per day. And so part of that is kind of a negotiation with the insurance provider to figure out what's going to be best for the patient. In general, though, I would say that, even among individuals who are checking, twice a day or maybe morning and in the evening, that these continuous glucose monitors, although, important for the patient from many different aspects, one, they are important because they can alert you if you're having low blood sugars. So some people, particularly with an A1C as low as 5.9, there may be points in the day when you're having a low blood sugar where these monitors would alert you to that. So that may be important for you. And then another area that I like to emphasize is that for many of my patients, something that we don't talk about a lot in the literature and on the physician side is that these continuous glucose monitors have been instrumental in them making behavior changes. Because you can immediately see the impact of different foods, for instance. So some of my patients say, well, if I have this fruit, my glucose goes up a little bit, but if I have this fruit, it goes up a lot. Right? And then also with physical activity, people can see how physical activity impacts their blood sugars. And so that often leads to them being more physically active. So, one part of it is the glucose monitoring piece. Which, like I say, is a conversation to have with your provider to see if there would be an additional benefit to it. And then the other part is the behavior change piece, where it really helps us with our behaviors as we manage type 2 diabetes as well.
Thank you. Another question from a caller. This is for Parveen from San Jose, California. Could you ask your question, please?
Hello. Hi, my name is Parveen. I'm from California. My question is, I take Humalog 3 times a day, and last dose I take around 7:30 in the evening, and I take my Lantus around 10:30 to 11 p.m. So I have a question that should I eat any light snack after taking Lantus?
Yeah, so that's a great question, Parveen. And what I often recommend in that situation is that your providers work with you to have a dose of Lantus that does not cause you to have low blood sugars. Thus, you would not need a snack with the Lantus. If we can get it dosed correctly, it should be pretty flat over the night and keep your blood sugars nice and flat over the night where they're not dipping, and thus you wouldn't need to take a snack with your Lantus. That is also another situation where a continuous glucose monitor particularly could be of a benefit here because you are already on insulin 3 times a day plus the Lantus dose in the evening. So the continuous glucose monitor could help you with the dosing of your insulin. Additionally, the continuous glucose monitor could assess to make sure that you're not having low blood sugars overnight, particularly when you guys are making the adjustment so that you can move away from taking that late night snack.
Thank you. Jackie, what is your question, please?
Thank you. Should I expect my endocrinologist to take my cholesterol and monitor my heart, or do I need to go to another type doctor?
Oh, that's a great question. And so, as part of the American Diabetes Association recommendations, there is a recommendation for your doctor to check your cholesterol profile, or what we sometimes call the Lipid Panel. Particularly at the initial medical evaluation, and then at least every 5 years thereafter, if not more frequently. For those who are on lipid-lowering medications, the recommendation is to check it at the time of initiation of the lipid-lowering medication, as well as about 1 month to 3 months after that, and then annually, unless there's some change in dose or something else going on. So at least an annual check for those who are on lipid-lowering medications. So your endocrinologist should be able to check those for you, as well as checking your blood pressure during the visits. Because really, when we think about diabetes care, we really think about the ABCs of diabetes care. So the hemoglobin A1C, or the blood sugar that we've been talking about a lot today, the blood pressure, and we want to make sure that blood pressure is under control, and then cholesterol. We will make sure that cholesterol is under control, because those are 3 of the main drivers of heart disease long term. And we know that if we can control those, we really lower the risk of heart disease and heart failure long term.
Thank you. As a kind of a follow-up question, the American Diabetes Association recommends an A1C below 7%. What are your feelings about, can that reduce the risk of getting heart disease?
Yeah, so that's an excellent question, Carla. And when you look at the historical data for an A1C less than 7%, there was really good, evidence for that from many kind of observational studies, as well as some of the data out of Europe. More recently, we've done studies including the CORE trial and another trial called the VADT trial, as well as the ADVANCE trial, where we shot for lower than 7%. We shot for either 6 or 6.5% as a target, and those did not show a benefit. So 7% seems to be about the sweet spot, because if you go lower than that, then you are at risk for low blood sugars that actually can drive increases in cardiovascular risk. And if you shoot higher than that, there's probably damage to the blood vessel, particularly as you get above, 8, 9, 10%, due to the actual blood sugar in the blood vessel. So less than 7% seems to be about the sweet spot for lowering the risk of heart disease, in addition to controlling blood pressure and blood cholesterol, as well as some of the newer medications that we also use for diabetes management.
So this is a nice follow-up question to that, and it's coming from Adrienne. Adrienne, could you let us know what your question is, please?
Yes, good afternoon, everyone. My question is, what is the danger number or the percentage for your A1C?
Yeah, so the danger number or the percentage. Okay, that's a great question, Adrian. And so when we think about a danger number, it's all about the A1C as well as whether the person is having low blood sugars. So it's a combination of those two. And so, we know that between 6.5% to 7% range is good for most individuals. Once we drop below 6%, we particularly want to make sure that we are addressing whether the person is having any low blood sugars. So when we get A1Cs in the 5s, I have patients with A1Cs in the 5s. The one thing I do is to make sure that they don't have low blood sugars. And so it's really a combination of thinking about the A1C as well as any hypoglycemia or low blood sugars. And once again, as we were talking about earlier, one of the ways that I do that is by using a continuous glucose monitor. And in the situation that you're bringing up, Adrian, sometimes I don't even do it long term. We have the option to do a 2-week continuous glucose monitor that we can put on in the office and that you can go home with. And so for my patients, as they're getting older and maybe have an A1C in 5.5 or 6% range, I'll often do a 2-week continuous glucose monitor just to ensure that they're not having any low blood sugars at home that we need to address.
Thank you. And this question follows kind of the low blood sugar issue. Walter, could you ask your question, please?
Yeah, it's somewhat related to the things you have been saying, Doctor. I had an appointment with my doctor yesterday, and in preparation for that appointment, I listed the last 40 days of what my blood sugars were, and it averaged out at 75.7. But in the recent past, it's been in the 60s. This morning it was 65. But I've been taking 2 medications, one metformin, and one is a generic form of Actos pioglitazone. And he told me I could stop taking the pioglitazone. And my question is, can you stop taking a medication like that without just cold turkey, or do you need to be weaned off of the medication, if you know what I'm saying? And I guess there's a danger in being too low as much as being too high. And what should I be doing with my AC1 of 5.6% is what it was yesterday.
Yeah, so those are great questions, Walter. I'm really glad that you called in with those questions. And so, and just to be actually, I got enough information there. So the recommendation now, I guess, is to come off of the pioglitazone, and I would agree with that recommendation. The metformin is overall not associated with low blood sugars. It's pretty safe from a low blood sugar standpoint. But Walter, you're getting to a situation where I would come off the pioglitazone, and I agree with that. And to answer your question, you can stop that one cold turkey. You don't have to wean it down, so you can stop the pioglitazone. But even once you stop the pioglitazone, I would still maintain your vigilance as far as checking your blood sugar numbers. And I'm not sure of your age, but it may be a situation where you can also decrease the metformin based on what those readings come back as. Because, we probably would want you, it sounded like probably above 6.5 or, at least above 6. And so as you're doing that, I would continue to check those numbers. And if your next A1C at 3 months is not, in the mid sixes or so, it may be that you can also, come down a bit on the metformin as well.
Thank you. So here's a question that's kind of off the numbers, but it is, we'll let this person ask. Richard from Clinton, North Carolina. What is your question, please?
Yes, I'm 91 years old, and I've had quadruple bypass heart surgery at 70, and I'm 5'8", and I used to weigh 220 pounds, and I got it down to about 172 pounds. And I'm wondering what you'd recommend for diet and exercise to help to prevent both diabetes and heart attack and stroke. And
Richard, do you have diabetes now?
Yeah, I had it, and then I got it down. I think it's a little under 7, as I remember.
Okay, and that's that a little under 7 is with no medications. Is that correct?
Right.
Yeah. So, Richard, it sounds like you're doing a lot of the things right. It sounds like you've been, eating a healthy diet, and that you've been physically active. And, at the age of 91, with an A1C less than 7%, I would not, recommend any additional, in general, I don't think there'll be many endocrinologists that would recommend additional medications, but it would be more, keeping it, right there around 7% for your A1C, and then, continuing those healthy modifiable behaviors that you're doing already, including, eating an appropriate diet as you're doing, being physically active, it sounds like you were doing. And then two things that people think about a little bit less is making sure that you're controlling your stress levels. And particularly around the time of this pandemic, where everyone is stressed, making sure that you have stress-relieving activities. That can be things just as simple as just listening to music for some books, or reading a book, or what are those things that kind of help reduce stress for you, as well as making sure you're getting an appropriate amount of sleep. For most people, that is about 7 to 8 hours a night. So ensuring that you're doing those healthy behaviors. But, at 91, it sounds like you're really doing fantastic, and I would just recommend keep up the good work.
Bonnie from Tukwila, Washington. Your question, please.
Hi. I got diabetes type 2 when I was in my 40s, and I was kind of slim and athletic. So I think they were kind of surprised, but I took metformin for 5 years, and then I started getting lows, and we decreased the dose, but we eventually took it away, and so it's been like 15 years or more since then. I'm keeping my hemoglobin A1C really good. My last one was 5.7. I think it is very likely I'm having lows, but I'm still functioning, and what I'm seeing is that I have doctors that want to tell me I'm not diabetic anymore, which I don't like, because I feel like then they won't pay attention to my lipids and my cholesterol, which I'm having harder trouble with than the A1C.
Yeah, so, the question always comes up about, diabetes remission or not having diabetes anymore. And, technically your A1C is at a range of kind of prediabetes, and you're not on any medications. But that doesn't mean that we shouldn't actively think about your cholesterol and your blood pressure. These are things that we should actively think about for all individuals. We just intensify them in individuals with diabetes. And so, I would continue to push, as you are doing, your healthcare team to address your cholesterol and your blood pressure, particularly if the cholesterol has been a little bit more of an issue. And then, the second piece that I would say is that, monitoring your blood sugars every once in a while, like when you wake up in the morning or before you go to bed, to ensure that you're not having low blood sugars is important, particularly, as your A1C continues to come down. So just doing some random blood sugar checks just to make sure that, your numbers are still okay would be an important thing to do. Thanks so much for that question, Bonnie.
So kind of on the thought of lipids, how often should someone with diabetes have their lipids checked, and does it change based on the person and their other comorbid conditions?
Yeah, so, in adults who are not taking lipid-lowering therapy, most commonly a statin, it is reasonable to obtain a cholesterol profile, when they are diagnosed, so at that time. And then really about every 5 years thereafter if they're under the age of 40, or more frequently if they are older than that. And then among individuals who are treated with a statin medication or other lipid-lowering medication, the recommendation is to take a cholesterol profile at the time of initiation of treatment, about 1 to 3 months after the initiation of that treatment or any changes in dose, and then at least once per year after that to help monitor the response to the medication and whether the person is doing well on the medication.
Thank you. And now here's a very timely question coming from Jean from New York. Jean, do you want to give us your question?
Hi. I don't know if you want to go there, but my nerves are shot with the COVID and the diabetes related. Scare about it. They always say it's high risk if you have diabetes, but I don't know why. Is it medically necessary for me to know why? Is there anything I can do? And it's scaring me, of course it's scaring me that I'm high risk and I don't want to be around people, and I don't know. I don't know if it's an appropriate question that you want to discuss with the whole audience.
Well, Jean, I love that question, and I know we are doing diabetes by the numbers today, but I am happy to take that question because, look, COVID is on everyone's mind, right? You can't do any discussions today in today's world without thinking about COVID. So let's talk about that a little bit, and we'll try to put a little numbers to it here and there. That way the American Heart Association, American Diabetes Association will also be happy. So everyone can win-win for everybody. And so when we think about diabetes, to answer your first question, Jean, diabetes, particularly uncontrolled diabetes, really impacts the immune system. And so it lowers our immunity and it lowers our ability to fight infections. The better control we have, the better our immunity. And so that's why we're really emphasizing controlling blood sugar numbers, having that A1C of 7% or less for most folks. For some individuals who are older, who may have underlying conditions, maybe less than 8%. But having those levels of control is really important in all times, particularly now in times of COVID. When we look at the rates of infection, we are not currently seeing differences in rates of infection for those with diabetes versus without diabetes. Where we do see differences is that after individuals are infected, individuals with diabetes are more likely to require hospitalization and are more likely to require needs for advanced care once hospitalized. And so it's really not the risk of infection that we're seeing in the data, but it's really once individuals are infected, there is a higher risk of outcomes that aren't as good. And so that really goes back to doing all those behaviors and being really persistent with all those behaviors that really limit our risk of infection. And what we have seen there, that two of the bigger ones are wearing a mask for both us as individuals as well as the communities in which we live, as well as adequate hand washing. And hand sanitizing. And then the last one that we've had to do at different places across the country is really social distancing when the levels of infection or levels of COVID-19 are high in the community. But, Jean, I hear from many individuals like yourself who have increased stress levels. And what I really encourage you to think about is what are those things that you can do to lower your stress level? Are you building in some of those behaviors into your daily routine to actually lower that stress? Earlier I mentioned, reading a book or listening to music as some things. Other people are doing yoga as a way to lower stress. But what are those stress-relieving behaviors that you can add into your life to really lower the stress? And why is that important? That is important because stress actually increases blood sugar, and stress also impairs the immune system. And so we really want to focus on limiting our stress during this time. And sometimes that means turning the TV off. It means different things to different people, but really limiting our stress as well as controlling our blood sugars are the two biggest things that we can do during this time when in combination with taking those healthy steps as far as mask wearing, hand sanitizing, and then social distancing. I hope that answers your question, G.
And here's a question from Catherine from Los Angeles. Catherine?
Hello?
Hi,
Hello,
Catherine. Are you
Catherine.
with us? Can you ask the question, please?
Hi. I live in Los Angeles. I'm 64 years old. I've been a diabetic ever since 2001, and it's been really hard for me. Everybody in my family, they're diabetics, but I can't get my blood sugar under 8. And when I go to the doctor, he gets very upset with me because he thinks that I'm making up excuses like, oh, I'm depressed or anything like that. But I have problems with low blood sugar, and I hate it when my sugar drops below like 50, 40, 30 like that. It messes me up for the whole day. And I just don't know what to do. My diabetes is out of control. I have high cholesterol. I have high blood pressure, and I'm on so many pills till it just really gets under my skin, and it depresses me.
Yes, and so, Catherine, you are describing what I usually refer to as diabetes distress, where diabetes is really distressing because of the continual needs for management, but also because you can't get it to where the level that it sounds like you really want. And this is where I really prefer a team-based approach, where there's a provider like myself, but also a diabetes educator to work closely with you, as well as a nutritionist to work closely with you, all on the same team. And the person at the center of that team, and I have this conversation all that time, is you, Catherine. And you need to be able to feel like when you go to the doctor or the healthcare provider that that they understand you and that they are working with you. And in some of your comments, it sounds like that may not be the situation. And so I would definitely seek a situation where you can have a team-based care approach. And in part of that approach, with your noting that you're having blood sugars down to the 30s, 40s, and 50s, really thinking strategically about what medications are used. I didn't go through and get whether you're on insulin or oral medications, etc., but what medications are used. Second, what is an appropriate target for you? So it sounds like you may be a person where an appropriate target would be less than 8% versus the less than 7% standard target. And then how can you all work together as a team to get there? And that would be my major focus for you, Catherine, is finding a team of providers that can really help you to address the diabetes.
Yeah, this may be a good time to talk about the option of a diabetes self-management education program, which you would qualify for. So diabetes education programs provide services that focus on your concerns about diabetes. They help to empower you with the knowledge and skills to manage it, and they link you to support resources in your community, which can be really important. You can find an ADA-approved program in your area by clicking on Find a Program link on the webpage, diabetes.org/experts. And you can also call the 800 number, which is 1-800-342-2383, and ask a member of the call center with assistance in identifying a program near you. Of note, diabetes education programs usually require a referral for your insurance, Medicare or Medicaid, to pay for it, but some of them are also available at a low cost for paying out of pocket if your insurance doesn't cover it. So just an FYI, that may be helpful as well. So let's get another question from Clara. Clara from Los Angeles, California. Are you on?
Yeah, I'm here.
Great. What is your question?
My question is, I experienced lately low blood sugar. To me, it's low, like 95, 109, 117, 119. Is that low blood sugar?
Yeah, Claire, that's a great question, and those are normal blood sugars. So 90s to 100s are very normal blood sugars in individuals with diabetes, and in some individuals, after they eat without even diabetes. But I think, Clara, that one of the things that can happen is that as we treat diabetes, for folks who have had higher blood sugars, I usually describe this as kind of like a thermostat. When the thermostat is turned up really high, and the body gets used to the thermostat being turned up that high, and that the way that I would think about that is blood sugars in, like, for instance, the 200 and 300s, and then we kind of normalize them. Even though they're in the normal level, the body can have these responses that actually make you feel like you're having a low blood sugar. So you can actually get sweaty, you can have some heart racing, and just not feel as great. And so one of the things to consider is, as you're doing, continue to check those blood sugars. And if they are in the normal range, I actually sometimes have patients drink a little bit of water. And they find that actually can relieve some of those symptoms for them. Now, this isn't, there's no, controlled study, on this, but that's something that, I've tried with many patients and have had a lot of success with as your body works to kind of re-equilibrate or, get that thermostat back to the level that it should be. But just to confirm, those are normal blood sugars for you there.
Mm-hmm. Another question that she had that she didn't ask, but was, what should her cholesterol levels be? So are there some target numbers we should be looking at for cholesterol readings or LDL readings?
Yeah, so it depends on the person and depends on whether they have a history of cardiovascular disease or not. And so most people with a history of a heart attack or a stroke previously, it's really an LDL less than 70 at this point is a kind of a broad recommendation. There is some differences in the different guidelines, but I think that when you look at the American Diabetes Association guidelines, they do recommend the addition of other therapies when the LDL is more than 70 on a maximally tolerated statin. And then for those who have not had a heart attack or a stroke, the first line recommendation is getting them on a statin medication. If they have, kind of moderate risk, we use a moderate intensity statin, and you can find what those are on the No Diabetes by Heart website. And then if they are at high risk, we use a high intensity statin with the goal of a more than 50% LDL reduction. And then so some people around the country commonly in that situation will say that they want to get the LDL less than 100. But there's a lot of conversation about that number right now.
Thank you. We have an online question coming in from Giles. I am newly diagnosed type 2 diabetic, and I have learned that a fasting glucose target is between 70 and 130. Is there an optimal target within that range, or is anything in that range just fine?
Yeah, so Giles, a great question. And, given that blood sugar fluctuates, we do give a nice range there. And I think that anything in that range is fine. For many of my patients, I actually use 80 to 130 just to give a little bit of leeway so that they don't have low blood sugars. But you're right, so 70 to 130 is fine, and anywhere in that range should be good. Now, some patients, if they're towards the top end of that range, and their A1C is coming up elevated, I may, try to push them a little bit lower, but that's really an individualized assessment and approach. So that would be something to talk about with your healthcare provider if, using those standard metrics, your A1C is still elevated. And, the other part of that is trying to monitoring throughout the day to see, what may be leading to elevation if that's the case.
Thank you. We have one other online question here from Linda. Are any of the continuous blood glucose monitors waterproof if we go swimming?
So yes, there are, and I want to say, and I'm blanking out right now. I want to say it's the. Do you know that, Carla? Is it the Omnipod that's waterproof?
Yeah. That's a pump, and that is waterproof. But all three continuous glucose monitors are waterproof.
Yes.
So you can swim with them, go to the ocean with them. You can take a bath with them. Yes.
Gotcha. I apologize. You were saying, she was saying CGM, and I was thinking pump. So yes, you're 100% correct there, Carla. Thank you for that.
Yeah. Here's a question coming in from Linda from Arizona. Linda, are you still on the line?
Thank you. Can you hear me okay?
Yes, thank you.
Awesome. Some of my questions have been answered, but I will go on with that. In the morning, I like to ride my stationary bike for a little over an hour, and then I do a reading of my blood sugar. And I'm finding that my readings are like 140 to the high 150s. Is it better to do a reading before I exercise and the first thing when getting up?
Yep. So I would definitely recommend doing it when you're first getting up prior to jumping on the stationary bike. And the reason for that is because for many individuals, the act of physical activity actually can increase stress hormones a little bit. So for some individuals, blood sugars go up a little bit with physical activity prior to coming down really nicely. And for other individuals, blood sugars just go down with physical activity. And so I would probably do it beforehand, and then you could actually do it when you woke up, and then after you got off the bike, so that way you can see whether your blood sugars are rising a little bit with physical activity or going down a little bit with physical activity. And that would be important to know and working with your provider to really optimize your diabetes care.
Thank you. If you could use support throughout the year, there's a few resources you might want to check out. One is Living with Type 2 Diabetes program, where participants receive information through email and e-booklets that provide support and information on emotional health, eating healthy, and physical activity, tips on managing and living well with Type 2 diabetes, as well as opportunities for support online and in your community. The link to sign up is on our registration page, diabetes.org/experts. And now we'll take our last question of the day. This is a good one coming from Mary of New Jersey. Mary, are you still on the line?
Yes, I am. Hello?
Could you ask your question? Yeah, could you ask your question, please?
Hello?
Hi, what is your question?
Oh, my question was, how does he define low blood sugar, and does it only apply for people taking medication? And also, like, is low blood sugar the same thing as reactive hypoglycemia?
Yeah, so great questions, Mary. And so the diagnostic criteria for low blood sugar would be a blood sugar less than 70. And then severe low blood sugars are less than 54. So those would be the two criteria that we use for low blood sugars. And then it is a little, the numbers aren't different, but it is a little different than reactive hypoglycemia, where we have hypoglycemia after we eat, for instance. And with that, we kind of go through a whole workup to kind of figure out exactly what's going on. And so, those are, just a little bit different as far as the low blood sugar with, like, for instance, taking medications and a reactive hypoglycemia. But great question, Mary, and appreciate that.
This wraps up our last question for this session. Boy, it went by quickly. A few items before we close for today. Consider staying online or on the phone to complete a short 5-question survey. We want to hear from all of you and hope you will take a few minutes to provide us with your useful feedback. To help you feel confident about your ability to manage your diabetes and heart health, we encourage you and your loved ones to talk to your doctor and dietitian about your risk. Go to knowdiabetesbyheart.org and learn more. Register for the next event at diabetes.org/experts. Sign up for diabetes education near you, and sign up for ADA's free Living with Type 2 Diabetes program. All of these links are on the Ask the Expert registration webpage, diabetes.org/experts. If you have questions about this event, want resources to find diabetes education classes in your area, or would like to receive an information packet to learn more about living with type 2 diabetes, you are welcome to contact us at askaba@diabetes.org or call 1-800-342-2383. If your question was not answered, please leave a voicemail with your question and email, and we will have an expert respond within a week via email. Thank you for listening. You can call back to the call center for a phone response at 1-800-342-2383. Thriving with diabetes takes a village, and we're here to support you. Special thanks to our expert, Dr. Joseph. I am Carla Cox. On behalf of the ADA team, we want to thank you for joining us today, and we look forward to connecting with you at our next Ask the Expert event, Best Foot Forward, Diabetes Foot Care, on September 8th at 2 p.m. Eastern Time. I'll turn it over to the survey portion to close out our program. Best wishes for good health.
All right. Thank you again for joining us today. We appreciate your feedback on today's event. To provide your responses, press the corresponding number on the keypad of your phone. And for participants online, please click on the poll section below the Ask a Question form and click to submit your responses. Okay, here is the first question. Overall, how satisfied were you with today's event, Diabetes by the Numbers? Use a scale from 1 to 5, with 1 being not at all satisfied and 5 being very satisfied. I'll repeat that question one more time for you. Overall, how satisfied were you with today's event, Diabetes by the Numbers? Use a scale from 1 to 5, with 1 being not at all satisfied and 5 being very satisfied. And while we take a moment for the next question to come up, I'd like to remind you about one of our programs supporting people living with type 2. If you were recently diagnosed or could benefit from a refresher, consider signing up for ADA's free program, Living with Type 2 Diabetes. Participants receive information via email and e-booklets throughout the year-long program on topics including emotional health, eating healthy, and physical fitness, as well as tips on managing and living well with type 2 diabetes. All right, here is question number 2. Standard of care recommends that 70% or more of your glucose be in a target range. What is that range? Press 1 for 60 to 140. Press 2 for 70 to 180. Press 3 for 80 to 200. Or press 4 for 90 to 225. And I'll repeat that again for you. Standard of care recommends that 70% or more of your glucose be in a target range. What is that range? Press 1 for 60 to 140. Press 2 for 70 to 180. Press 3 for 80 to 200. Or press 4 for 90 to 225. And before we go on to question 3, we'd like to let you know that if you missed a part of today's event or you'd like to listen again, we have full recordings available by phone. You can call the toll-free number, which is 866-686-8240 to hear the latest recording. Again, that phone number is 866-686-8240. And you can also find the full recordings on our website, diabetes.org/expert. Okay, here's question 3. True or false? Keeping an A1C below 7% can reduce the risk for complications of diabetes like heart disease. Press 1 for true, press 2 for false, or press 3 for not sure. Now repeat that again for you. True or false? Keeping an A1C below 7% can reduce the risk for complications of diabetes like heart disease. Press 1 for true, press 2 for false, or press 3 for not sure. And before we move on to the next question, we would like to remind you again of our next Ask the Expert Q&A event, taking place on September 8th at 2 p.m. Eastern Time. Our guest expert will discuss foot care for type 2 diabetes and how you can keep your feet healthy. To register for that event, go to diabetes.org/expert or contact 1-800-DIABETES, which is 1-800-342-2383 to register. Okay, here's question 4. As a result of this event, how likely are you to schedule a visit with your healthcare provider to talk about the link between heart disease and diabetes? Press 1 for not likely, press 2 for somewhat likely, or press 3 for very likely. And I'll repeat that again for you. As a result of this event, how likely are you to schedule a visit with your healthcare provider to talk about the link between heart disease and diabetes? Press 1 for not likely, press 2 for somewhat likely, or press 3 for very likely. And while we wait for the last question, remember that a diabetes self-management education and support program referenced earlier will focus on your concerns about diabetes. This program will help empower you with the knowledge and skills to help you manage your diabetes. You can find a link to ADA-recognized diabetes education program at the bottom of our Ask the Expert webpage, which again is diabetes.org/expert, or you can call and speak to a member of our call center to find a program near you. And that call center number again is 1-800-DIABETES. Okay, here's our final question. As a result of this event, how likely are you to sign up for or continue to participate in a diabetes self-management education program? Remember, diabetes education programs usually require a referral from a healthcare provider. Press 1 for not likely, press 2 for somewhat likely, or press 3 for very likely. And I'll repeat that one more time. As a result of this event, how likely are you to sign up for or continue to participate in a diabetes self-management education program? Remember, diabetes education programs usually require a referral from a healthcare provider. Press 1 for not likely, press 2 for somewhat likely, or press 3 for very likely. Okay, thank you for staying with us and providing your feedback on today's event. We offer many thanks to today's expert, Dr. Joseph, as well as our support vendors and sponsors and the No Diabetes by Heart collaboration. This concludes today's program in the Ask the Expert Q&A series. If you have your email address on file, you can expect to receive an email with resources from today's event, or you can also go to our website, Again, diabetes.org/expert to find those resources on the August 11th event page. And lastly, if you have any additional feedback for our team, please stay on the line and leave a message after you hear the final recording. Thank you and stay well.